The Coordinating Minister of Health and Social Welfare, Muhammad Ali Pate, has highlighted significant achievements in Nigeria healthcare sector under President Bola Ahmed Tinubu's administration during a ministerial press briefing in Abuja. In the past year, over 201 infrastructure projects have been completed across federal hospitals, including renovations, expansions, and new outpatient and diagnostic centers, enhancing healthcare capacity nationwide. Additionally, about 179 essential pieces of medical equipment have been procured and distributed.
Outcomes. And it's not only the health sector, but other sectors of government contribute in that direction. We have 30 teaching hospitals, 22 federal medical centers, and 21 specialty hospitals, 5 agencies, 16 regulatory bodies, in addition to our 10 departments and 3 special units. Those are at the federal level. At the primary healthcare level, through the National Primary Healthcare Development Agency, we have laid out a plan to reach the 8,300 primary healthcare centers and expand them to 17,000 primary healthcare centers, to refurbish them, to make them functional, to deliver essential services, whether it's immunization, maternal, newborn, and child health services, or treatment of non-communicable diseases, and to refer to secondary facilities. But we require the states to complement what the federal government is doing. Now, over the period, in our federal hospitals, we are able to execute 201 infrastructure projects and 179 discrete important equipment that were procured by the federal government across the 36 states of the Federation. Over the last 9 months, in 33 federal tertiary hospitals, 4.5 million Nigerians were able to access outpatient services, and 1.6 million Nigerians had inpatient admissions in those 33 facilities. So if you extrapolate for the 72 facilities, you can logically expect about 78 million Nigerians who are ill, who sought services from federal facilities, and about 2.5 million Nigerians who have gotten inpatient admission in our facilities. We doubled the intake, the enrollment, the quotas, schools, medical schools, nursing schools, and other health professionals. We doubled it from an enrollment target of 28,000 a year to now 64,000. Now that is just the first step. The education sector will have to play in, the states will have to play in to improve the infrastructure, the training, the tools to produce more health workforce.
Well, looking ahead, the government plans to launch 10 new healthcare infrastructure projects through the Nigerian Sovereign Investment Authority, NSIA, including diagnostic centers and oncology facilities.
We had announced we will retrain 120,000 frontline health workers in September. Now, that's an agenda that we laid out for the next three years. His Excellency, Mr. President, was recognized by the African Union as the African champion for human resources for health and for community health delivery partnership, for community health delivery at the meeting of the African Union heads of state in February 2024. Now, to fulfill that promise, under the direction of the President, we have reviewed the training guidelines, the content, the curriculum for those frontline health workers at the primary healthcare level at the states. The trainers have been trained themselves in all the states of the Federation. And I believe in the next 1 or 2 weeks, the training itself will commence. The guidelines have been revised, printed, and we raise the resources to be able to do that. So that over the next 3 years, at least 120,000 frontline health workers, those who are serving our population in rural areas, will have the capability, the skills, in addition to the infrastructure and the equipment that we have provided.
And the administration is also pursuing public-private partnerships to expand and equip 6 teaching hospitals, further strengthening healthcare infrastructure and fostering collaboration between the public and private sectors.